Hi, I'm Whitney, and this is my persuasive speech. There's my audience. Medical marijuana for ill people. I know many people hear the word medical marijuana and think that it's a drug, in which cases, sometimes it is. The difference is this specific drug has many helpful properties for patients who are ill. Marijuana is a widely known drug that has been found to help patients cope with these conditions, such as Alzheimer's disease, anorexia, AIDS, cachexia, cancer, Crohn's disease, epilepsy, glaucoma, HIV, migraines, multiple sclerosis, nausea, pain, spasticity, wasting syndrome, and many more. Let's look at this image showing how many areas that cannabinoids help. That being said, cannabis has been used for medicinal purposes for approximately 4,000 years. Writings from ancient India confirm that its psychoactive properties were recognized, and doctors used for a variety of illnesses and ailments. Medical marijuana has been said to help with pain management, mood disorder, and Crohn's disease. Did you know that pain management is one of the major reasons that medical marijuana is most often requested? Pain is the main reason people ask for a prescription, says Barth Wilsey, MD, a pain medicine specialist at the University of California, Davis Medical Center. It could be from headaches, a disease like cancer, or a long-term condition like glaucoma or nerve pain. In the 1800s, marijuana was widely used for pain relief, as well as studies finding cannabinoids have analgesic effects. Scientists have known for many years that cannabinoids, the major active ingredient in cannabis medicines, are potent pain relievers, and they have act synergistically with opiates to increase the degree of pain relief. The addition of cannabis medicines to therapeutic regimens can reduce the need for opiates by 50% or more in many patients, while also reducing side effects such as constipation that opiates commonly produce. Did you know our bodies create marijuana-like chemicals? Your body already makes marijuana-like chemicals that affect pain, inflammation, and many other processes. Pain management is a feeling that medical marijuana can help just like mood disorders. Mood disorders such as depression, bipolar disorder, and anxiety are said to be helped by medical marijuana. Look at this chart showing the difference in respondents with marijuana dependency. It is showing how well those dependents on marijuana reacted. Depression is a serious mood disorder that even sometimes relates to suicide attempts and deaths. Consistent with the hypothesis that marijuana can be an effective treatment for depression and other mood disorders, there appears to be a sharp decrease in the suicide rate of 15 through 19-year-old males in the treatment states as compared to the controlled states approximately 2 years after legalization. Those who consume marijuana occasionally or even daily have lower levels of depressive symptoms than those who have never tried marijuana. Specifically, weekly users had less depressed mood, more positive effects, and fewer somatic complaints than non-users. Daily users reported less depressed mood and more positive effects than non-users. This obviously is foreign to some people because they haven't had to deal with these kinds of disorders. People who have never struggled with a life threatening or disabling illness often do not comprehend how debilitating or the resulting depression can be. Long days spent struggling with sickness can wear patients down, suppress their appetites, and slowly destroy their wills to live. The psychological damage can result in psychological effects that may be the difference between living and dying. Would you take away someone's will to live because you don't believe in this drug? Mood disorders are just as much a disease as any disease, even Crohn's disease. Did you know that treating Crohn's disease with medical marijuana improves patients' conditions? In the present preliminary prospective study, they have found that treatment with inhaled cannabis improves quality of life in patients with long-standing Crohn's disease and ulcerative colitis. Treatment was also shown to cause a statistically significant rise in patients' weight after 3 months of treatment, and improvement in a clinical disease activity index in patients with Crohn's disease. In fact, as was shown in the result, there was statistically significant improvements in patients' ability to work after treatment. Beneficial effects were reported for appetite, pain, nausea, vomiting, fatigue, activity, and depression. Patients also reported that cannabis use resulted in weight gain, fewer stools per day, and fewer flare-ups of less severity. With Crohn's disease being such a debilitating disease and so difficult to manage with conventional medication, it is very encouraging to find that cannabis is proving to be an effective treatment for it right now. Pain management, mood disorder, and Crohn's disease are all helped by the use of medical marijuana. Let's all be smart and help the people with uncomfortable and life-changing diseases and disorders. Legalize medical marijuana so that the ill can enjoy the comfort and ability to live everyday life. Thank you.